Good morning, everybody. Thank you so much for joining us. My name is Darian Jones. I'm the Digital and Development Specialist at Care Partners. We're so excited that you're able to join us this morning. We're here with another hot topic segment. Super excited about this one. We're going to be talking about all the different types of dementia and how to kind of differentiate them and just kind of understanding how they work. Before we get started, I just wanted to say we have so many updates and information and resources on the Care Partners website that we would love for you to visit and check out. We have over 80 other hot topic segments like this where we talk about so many different things. We try to cover as many different topics as possible that are interesting and relevant to you. So we'd really love if you could check that out on our website. If you ever have any questions or you need to connect with us or anything at all, you can always give us a call at 713-682-5995. And of course, you can always send us an email at info@carepartnerstexas.org. We'd love to see what you're up to if you have any pictures. And we'd love to just hear what's going on in your lives or if there's any way that we can help. So please feel free to reach out anytime. We are so excited to start shifting our focus into more of our in-person programs again. So our online Common Ground has finished, but we are so excited to get those up and running in person. So you can find more information again on our website at carepartnerstexas.org. All right, so I think with that, we're going to introduce our guest for today. Gina, how are you doing this morning?
I'm good, Darian. How are you?
I'm great. Thank you so much for being here. I'm really looking forward to the topic today. I think it's going to be a really interesting one. But would you mind just telling us a little about yourself and what you do? And then feel free to go ahead and take it away.
Okay. I am the owner of Dementia Untangled Consulting Services. I educate families in their home to help them with any issues that their loved ones may be facing. Could be behavioral, just general safety, just trying to help the loved one manage in home any issues that their loved one has dementia and its related diseases are facing. I also teach caregivers, say, and it could be a facility or a residential care home, how to interact, how to take care of people with dementia. So that's what I do.
Well, we're so excited that you're here, as I said. Would you mind just telling us about the topic today?
Sure. Today I'm going to be discussing, and I picked 4 of the main common types of dementia. So I'll be kind of breaking them down, giving them maybe symptoms, maybe things that you'll be able to see, and just help you to understand a little bit better some of the different forms of dementia that they have out there. There is a lot more that I probably didn't have time to cover. So I just chose today the first 4 that are the most common.
Great. Well, feel free to take it away. Thank you so much.
Thank you. All right, so I'm so glad to be here today. Thank you so much for inviting me into your home, and hopefully I'll be able to get you some new information that you didn't have before in regard to this disease called dementia. So we're going to start off with dementia and what it is. So we want to first look at dementia as an umbrella term. It is a general term in regard to brain changes, brain disease. It differentiates itself from the age-related, which is common for many people as they get older. I forgot my keys. Tell me your name again. Just different things like that. Why did I walk into this room? Which happens quite often. And I think sometimes people get scared. They're like, oh my gosh, I'm forgetting this, when they get nervous. But I think that those are, when you talk to people, especially around your age, depending 50s, 60s, you may see that that's pretty common. Maybe you or your friends are feeling like, gosh, I forget things too, and I can't believe I forgot this, or, those different aspects. And those often are age-related. Dementia is actually a disease process. It is a degenerative disease of the brain. It is progressive, and unfortunately right now it is always fatal. So we're going to just cover some of these today. So like I said, dementia is the umbrella term. Some of these symptoms could come on quickly, and some of them can progress slowly. There is right now actually no way to know how a person who has a disease diagnosis will progress. It is an absolutely individual process. So that could be a little hard to understand or decipher. It can be a little discerning, I guess, to try to face that. But today we're going to start off with Alzheimer's. It is the most common disease under the dementia umbrella. It was named by Alois, I think I'm pronouncing his name correctly, Alois Alzheimer's. And he first started working with patients back in 1906. Started noticing the brain changes, the behavior changes, and the ultimate death of his patients. He also was a neuroscientist, so very well regarded in the community. It's unfortunate that even over 100 years later, we might know what's happening, but unfortunately, there's not been a lot of progress in the area of why it's happening. So the actual changes are buildup of plaque and tangles. So there's proteins within the brain that are they actually grow around the nerves, which are the neurons of the brain. And what ultimately happens is those pathways, because if you're looking at a brain cells, they connect one to another. That's how we learn. That's how the brain works. The neurons, those nerve cells get tangled, and then the communication can't go between one nerve cell to the other. And that's why you're seeing what, in actuality is brain damage. Right now, there's about 6.2 million people in the United States alone that have that diagnosis. It's going to increase inevitably unless they come up with a cure, because there's approximately 10,000 people a day that are hitting 65. So it is going to be more of a global pandemic, because we're finding that more people, it could be that they're living longer, but also because we just have no real treatment. I mean, there's some medications that can be used, but the treatment is not there yet, as far as actually finding out how to reverse it. Why is it happening? Why is this plaque accumulating on the brain? So we are kind of in there's a lot of research. Alzheimer's Association, they have, great grants and great doctors, and they're doing so much, trying so hard to try to find a cure, something maybe even to slow the progression more than just the small amount that the medications that are out there have. Now, you'll be able to see with Alzheimer's, because it is the most common, those are the things that you'll see. Somebody that you might see some personality changes. You'll see changes in somebody's everyday life. Again, say if you notice your loved one is generally very neat, everything is always put in their place. And all of a sudden you're noticing when you go to visit, or if you happen to live with them, things might be a little more untidy. The bed's not getting made. Maybe their personal appearance has changed. They might not be combing their hair. For ladies, maybe who took care in their appearance with makeup and dressing, suddenly they don't know how to match their clothing. Maybe they're coming out, maybe not even fully dressed. I see it all the time because I do work in a facility. So this is something that I see every day. Somebody coming out maybe with a pajama top and maybe a brief or nothing underneath. They just don't even realize that it's happening. Now, these are more advanced. You probably will not see that as much in the home. Oftentimes, by the time someone gets to that stage, we have them in our facility. So, like I said, maybe skills that they had before. Your family member maybe knew how to cook, maybe had some skills, gardening, working on cars, whatever it could be, whatever their passion was, their job was, and now you're finding that they are unable to complete it in a correct manner. So I've taken care of people. I remember this one gentleman, he was so sweet. He used to work as a handyman contractor. And when we got him, he used to walk around our facility with more of like a child-safe tool, and he would fix things. You would see him kind of bending over where he'd saw screws and trying to screw things in. He would try to go over and he'd move things around, or he'd fix a picture. And, he was continuing his previous employment, but just in a way that you could see was not to the capacity that he did before. So those are all, you'll see decline. That's what the main word is. You will see decline in previous abilities and different parts of their personality. Secondly, we'll go to frontotemporal dementia. This was formerly known as Pick's disease. Now, this area, it affects the front lobe or the area temporal behind the ears. What's common about this one, and this is something that I see, and this one's, I think, tends to be a little bit more troubling for family members. You will see a lot of personality changes. So that whole frontal lobe, you're talking about people that have the ability to maybe have a filter. And as that brain is diseased, the process is happening, that person may not have a filter anymore. You might, and I've had taken care of so many people who suddenly, their loved ones are mortified because their loved one, their mother, is cursing. I took care of this lovely lady, and she suddenly developed quite a colorful language. And we had talked to the daughter, and she actually said to me, she's like, Gina, my mother was a white lace Catholic. She would never, never say these words. And I said, well, she's saying them now, and it's okay. The families often get very upset when they see the changes happening with their loved ones. Somebody could disrobe in public. Maybe the comments out of their mouth are so out of character for how they always were. Maybe somebody that was very dignified is now being demanding, unkind, saying, maybe making a comment about somebody's appearance, those kind of things. That is very common with the temporal dementia. They may start to have difficulties with language, being able to find that speech, being able to find those words. That you'll find more distressing to them because they're trying to tell you something and they can't get those words out or what their needs are. And that's very distressing to the actual person who has dementia. Let's see. So the behavioral variant is the one, like I said. What happens is, the filter is gone. So with a healthy minded person, you might think that person has an ugly dress, but you're not going to say it. You might be angry at somebody and want to say something unkind, but you have the ability to stop yourself. Well, when you have frontal lobe dementia, that filter is gone. You see no reason to not say what's on your mind. And it can be very, like I said, the person with dementia doesn't seem to mind that they have this new ability, but the family members and people around them, it can be quite disturbing. I tell you, just relax. Don't, this is a brain disease. This is not somebody choosing to suddenly be unkind or say things that are inappropriate. It's not their decision. And I'm sure that, obviously when you knew them when they were younger and healthier, they would never say or do some of the things that they're doing now. But please try to be patient with them. This is it's a brain disease. The actual neurons in the brain are diseased. They're destroyed. So your loved one does not have the ability to stop what they're doing. So just kind of, be patient with them as you would with any, if somebody has a disease, say cancer, you're not going to get frustrated with them because they're sick. If they are vomiting after chemo, you're not going to get upset because they're vomiting. Kind of take it in the same way. Just remember that your loved one is doing the best they can. The frustrations, I can't even imagine how they feel, trying to live in this reality that's so altered and confusing and, loud and just not knowing how to manage, and they're doing the best they can. So I would encourage you just to be patient with them. And actually, the level of compassion needs to be there because they have a disease that will take their life at some point. So just be patient with them when it comes to that. Oftentimes you'll find some regression. So, we have a continuum of life. You start out as a child and you'll have, obviously your parents feed you and care for you, and you get that upswing of as you grow, you're learning more things, you're capable of doing more things. And that's just the general life. Well, what happens with someone with dementia, that pendulum starts to swing the other way. So when you lose the ability to filter your thoughts, oftentimes I have if you have a family member who, or even like a child, so they don't always understand the need to be polite or to be kind, and they kind of speak what's, in their mind. A person with this dementia also, they can be unkind. So that what's happening is the pendulum is swinging the other way. You may see childlike behaviors, someone who will come up and grab something out of somebody else's hand, same way a child would. That's mine, and you can't have that. Or they'll say, just things kind of like what you'd see a younger person saying. And that's how you can see that brain is, instead of the growth that you see with a normal, life cycle, you see it start to decline, all the way back into, even if they do have a longer process where they go back to small child and even infant brain ability, because you will be obviously, they cannot stay continent. They need to be toileted. They need to be changed. They don't understand, the body doesn't know to hold the urine or the bowel at times. And then depending also, it could go back to even more of an infantile where you are feeding them because they are no longer able to do it on their own. So that is right now the progression of dementia. And again, it could change. I've been a nurse for 11 years now, and I have, each disease process can affect somebody differently, and how they go about that, it can be very different. So I could never tell you your loved one's going to go through this exactly, except the only thing is that it's inevitable that they will deteriorate, they will decline, and they will pass away from this disease. Hopefully within my lifetime, we will find a cure, and that would be wonderful. And then I'm out of a job, which is okay. So now there's something called just got to look at it real quick to make sure I'm saying it correctly. Primary progressive aphasia. So that's a second major form of the frontal temporal. Then you'll see a lot of changes with language skills, speaking, writing, and understanding. That is, like I did touch on it before, it's very frustrating for a person with dementia when they can't find the words. I know even myself being younger, it's like, darn it, what am I trying to say? And it's minor, but these are people that are trying so hard to get you to understand something. They have something to say, but the brain cannot. And just remember that it's said that they don't want to. The brain actually physically cannot get out what they're trying to say. One day I cared for this lady, and she was so distressed because her dementia is progressing. Her language, her ability to express what she needs is declining. And I can see it as I've known her for about 2.5 years, but I've worked directly with her since October of last year. And now it's July, sorry. And she's trying to tell me something, and I'm trying so hard to like pick little words and trying to understand, because she's crying and she's distressed, which is often the case. They just are so frustrated because they want to tell you something. And I was going back and forth and trying to, really decipher what she's saying. And I heard her say the word wet. So my first thought was, well, are you wet? And I was looking at her clothing, and she's like, no. And I thought to myself, just because, again, I've been doing this so long, like, do we need to go to the bathroom? Yes. And we went to the bathroom. It turned out her depend was wet, but she couldn't tell me. And, once we realized, I said, oh, this is fixable. We can take care of this. And we did. We brought her in, we got her cleaned up, and she felt so much better. And there are times like I try to, when I teach people, or, if I'm talking to somebody about what I do, I think lately what it feels like for me, it's kind of like you're trying to do a tango dance with somebody, but I don't know the steps. I don't know how to do the tango. So I'm trying one step at a time to manage this dance and be able to get something together. And it's like, I'm trying so hard because I don't want my resident to be distressed. I don't want them to be crying because they can't tell me what it is that they want. So if I'm able to find, like when she said wet, it's not like a very fancy thing. Wet can encompass a lot of things. But when I was able to find out that this is what her need was, I felt so much better. Like it really makes me happy. I'm like, oh, I figured it out. I got that step in that tango, and it felt good. And I was able to help her and relieve her anxiety and her distress. And to me, that just feels so good. I love doing that. Okay, now we go into vascular dementia. So vascular dementia is where there is a lack of blood flow within the brain. It can happen pretty much anywhere. As you get older, the ability, your blood vessels and stuff, they can be compromised. You could see issues within the extremities. But vascular dementia does seem to affect the brain even more. It will kill. So without the blood brings the blood throughout the body. This is how the body heals, how the body is nourished. And if you don't have blood supply, wherever that blood supply is gone, you have death. So in this case, you're having death within the cells of the brain. It can happen after a stroke. It could happen just, again, in age related. There could be a lot of strokes. Now you can see them on a CT scan. It will show the damage within it. Now there's not a lot of tests to do for dementia. Oftentimes these things can be confirmed upon death and autopsy, but the CT scan can show whether there's been an issue with the blood supply in the brain. Let's see. And also the CT scan can also show if there's been any shrinkage. So you'll see, I don't know if you know this, when a child is born, their brain is fairly smooth. as the brain develops and as those neurons, every new experience that that child has from birth on up until, the disease or general aging, you'll see there's connections. All those neuron connections is what brings us, at least from a cognitive stance, from an infant to an adult. So again, when you have the dementia and you have the decline, you'll see that the brain will actually start to shrink. So again, these are all, now there can be kind of like if you're working with someone dementia, you can kind of sometimes see that they maybe overlap, like the person may have a diagnosis of Alzheimer's disease, but then you might be noticing, again, with the lack of filter or, just, let me try to think, lack of filter or different changes that it's like might be fitting into like either a frontal, temporal or, vascular. So they can sometimes intertwine. That's pretty common. So again, it's again, progressive brain disease. And what we're going to talk about next is Lewy body. So Lewy body, Dr. Lewy was actually, he worked with Alzheimer back in the early 1900s. It is the third most common form of dementia. It accounts for about 5 to 10%. So Lewy bodies, you'll see an increase in things like hallucinations. That is very common. Hold on. So forgive me 1 second, I'm sorry. Alzheimer's and Lewy bodies also kind of mock a Parkinson's diagnosis. So you'll often see the brain loses the ability to know what to do. So that person might try to walk and they don't know what to do with their feet because the brain doesn't have the automatic one foot in front of the other. So those are common with a Lewy body. They have problems. Sorry, my allergies are bothering me today. I'm so sorry. So you'll have trouble reasoning. And many people have, like I said, their bodies start to hunch over. They're losing the ability to control more of the physical movements of the body, being able to grab things that they used to. And you'll see that sometimes if you're trying to maybe get a loved one or a person, if you're caring for them just in general, dress, and they don't know how to raise their arm up to get their shirt on, and even to get them to sit down. Say, so I'm going to sit you down on the toilet, or we're going to sit down on a chair. Maybe I need to change your shoes, or we're going to, put something on or off. And the brain is having a hard time. They've heard you, they've physically heard you request that, but then they don't know what to do after. The body doesn't respond. You don't, and that's why we use like light physical touch, help them to sit down and maybe touch them, or maybe even touch behind the knee and say, bend here, bend here. So there's a lot more physical communication, I guess the word is, with someone with a Lewy body, because you want to be able to you're guiding them with your hands. And oftentimes that does work. If I'm trying to get a loved one or a resident to raise their hand, I might trying to get that in the screen, I might actually use my hand on their hand to raise their arm up if I'm trying to either put a shirt on or off. Same thing with, the lower garments as well. So they need just the extra help. And sometimes it's, like if I need them to move, say if we're starting to walk, I might have them move I touch the right leg. Let's move this one forward, or opposite, here, move this one. I might have to, they may do well with like continual reminders. Say I'm walking with someone down the hallway and they just stop and they don't know what to do next. And I'll say 1 foot in front of the other. And then it kind of clicks and they might be able to get a few more steps before the brain forgets what it's doing again. So or I also say, take big steps, because they'll shuffle. That's also very common with the Lewy bodies, which, like I said, also presents like a Parkinson's kind of partner. Their feet shuffle. So there's a lot of reminding, a lot of verbal or physical reminders of how to get them to progress in whatever their activity is, and be patient, because their brain, again, it doesn't work as they would like it to, and we're just trying to help them. We're helping them. Could be 5 seconds later, and I've done this often where they're starting to shuffle. I'm like, pick up your feet, big steps, good. And then they do it for about 10 steps, and then they start to shuffle, and then tell them again, big steps. So it's helpful to be able to guide them. And again, patience with our folks. If, it'll make you feel better. It'll get kind of like the job done. It will help them. And they will also feel more comfortable with you being around them when they know that you are going to be patient with whatever they're struggling with. Again, now with hallucinations in the Lewy body, generally what I do is if my resident is not being distressed by their hallucination, if they're seeing a child in the corner or children playing, if they see a cat or a dog and it's not disturbing to them, I might kind of join into their world and say, oh my gosh, what a beautiful baby. Or, oh my gosh, like, I love dogs. Do you love dogs? And you kind of just join them. And if it's not distressing, I don't intervene. I just kind of leave it and I let them tell me who was visiting them a little while ago in their apartment. If it's distressing, I've taken care of people where they feel like their loved one was thrown from a balcony. They are distressed. They are, crying. I mean, I've had people call 911 because their hallucination is telling them that their loved one is in danger or maybe has been shot or stabbed or, victimized in some way. Those are the ones that you want to get a doctor's intervention because they would need to be on some medication that could help ease that. We don't want somebody being distressed. Let's see. One of the things I think I was talking to you, Darian, before was the idea of having their things stolen. Again, it's very, very common for people with dementia to think that someone has stolen their anything, their shoes, their pajamas, their purse. I often join into that and just try to say, I will do my best to find your whatever it is that they're missing. I don't correct them and tell them that there's no way someone stole their purse. If I'm able to, if they're out of their apartment, I'll go and look for the purse or I'll look for that lost item. But the confirmation that I give them, the affirmation that I am concerned about what they're telling me, that I care about, that they're upset about something, and then I do my best to try to. And oftentimes I have found a purse or a shoe just could be in a garbage, could be in a refrigerator, all those kind of things. So that's why I say I picked 4 today because I knew that I would end up talking too much and run out of time. But those are the 4 main dementia types. I hope that I gave you some more information today that maybe you didn't have before. It was just my pleasure. Thank you, Darian, for letting me come on Care Partners today to share just where my heart is with this disease and people that I am so blessed to take care of every day. So I think I did my time. It's hard to tell you. I talk so fast sometimes I'm like, I'm going to cover all this topic and I'm going to look down on my clock. It's like, shoot, it's 10:15 and I'm done.
No, you're totally fine. I find it so, I don't know, interesting is not the right word, but crazy, I guess, how many different types there are and how they all affect you differently or they all affect the person differently. So
yeah. Well, when you look at the different parts of the brain, each one has different, each part has its own purpose. So depending on where that disease is affecting, it's going to affect the part of the brain that, like I said, with the frontal temporal, especially with things like, outbursts and cursing and swearing, sexual inappropriateness, very common. Just that the brain, that frontal part of the brain doesn't know how to filter itself anymore. So it is very interesting. It's still very sad that 116 years later, and we haven't made a lot of progress other than knowing what's happening. We haven't made a lot of progress in how to treat it because, like there's a blood-brain barrier. So there could be medications and the brain, it's such a great organ, but it's made to protect, the body was made to protect the brain. So I think it's hard for medications to be able to get through into that blood supply to get up to the brain if they could even find something that either can remove that plaque or we haven't found out what causes the plaque. We're still, I think that it's been very difficult to make any real progress so far. So we're still waiting. We're still waiting for that breakthrough.
But in the meantime, we are so grateful for people like you who help us understand all these different types and the symptoms and just how to care for our loved ones who are going through this. So thank you so much for being here. And I encourage everyone to go find Gina on Facebook and connect with her there. I think we're going to wrap it up though, but thank you so much for being here.
Thank you so much for having me.
And everyone at home, thank you all so much. We will see you all next time. Have a wonderful